Hey guys, Dr. Jake Ackerson with Excel Chiropractic and Wellness, and in today's video we're going to talk to you about one of the most common ailments in America today. So common that recent research shows that 80% of all Americans will experience this ailment. What we're talking about? Low back pain. Now low back pain isn't something that we should be dealing with, but because of our 21st century habits, how we drive, how we eat, how we sleep, even how we exercise, all of these things can lead to low back pain, especially if we're doing them not functioning properly. So most people will come in and tell us that they've had this pain before, but it goes away within 2 weeks, or if I put a little bit of ice on it. And then, sure enough, 2 months later, they have another bout of low back pain. Our goal here is to make sure that we educate our patients on how to deal with that low back pain and make sure it doesn't come back in the future. And so throughout this video, we're going to talk about what we do to help diagnose your issue, how we treat it, and how we can prevent it from happening again in your life. Now there are two main causes of low back pain, and they're going to be chronic low back pain and acute low back pain. Acute is something that usually most people understand why they have the low back pain. So they either had a car accident, they fell down a flight of stairs, they had an old football injury. They know when the pain started. Chronic pain can be a little bit harder of an issue to determine where the low back pain came from, because most people will come in and say, well, I didn't do anything. I bent over to pick up a Tupperware lid off the ground and my back popped and I had sharp shooting pain going down my leg. That's where we really want to try to find the main cause of the problem. And it can be from multiple things, but it could also be from an old injury that you didn't deal with over the years. And then all of a sudden, after years and years of abuse, picking up a Tupperware lid off the ground, your body said, that's the last straw. That's where I draw the line. Here's some pain, here's some spasming, and until you do something about it, we're going to be stuck here. So that's where we use our examination process to determine how this happened to you. So through functional exams, orthopedic exams, and then just an examination of how the body is functioning overall, we were able to determine whether this is a cause of acute problem or it's a chronic issue. If it's a chronic issue, you may have tissue damage. And it can be tissue damage that is irreversible, or it can be tissue damage that can be reversed, because the body is an amazing thing that can heal from lots of damage. Now, whether it is acute pain or chronic pain, muscle and joint dysfunction is why we're experiencing that pain. And when we have problems in our spine, so if we have a misalignment in the joint here, if it is misaligned, your body knows that this is going to be a problem, especially for these nerves that are coming out that control the rest of our body. So what will happen is the body will come in with muscles and they will splint the area, making sure that you don't have immobility, or that you have immobility, because if you can't move, you can't do more damage on the area. And what you're supposed to do is stop doing the thing that is causing the problem. So when we restore proper motion to the area with chiropractic care, with rehabilitative exercises, your body then all of a sudden is starting to talk to the brain again and restoring proper function. There's no need for the pain signal that comes in. So in our office, we really like to focus on our examination process. We feel that it's very important to be very thorough. So throughout the exam, we will do a chiropractic, orthopedic, neurological, and functional examination to make sure that we are really getting to the root cause of your problem. And throughout the exam, making sure that we have great communication with the patient so that they are getting the feedback, giving the feedback to us, and we can tailor all of our treatment to what's going on with you. And if the examination shows to us that you need x-rays, we have the benefit in our office of having a digital x-ray machine. And that digital x-ray machine will give us instant results, and that way we can also then tailor your treatment plan to what's going on, not only with what we find in the orthopedic and functional examination, but also what's going on with the x-ray findings too. Now throughout the treatment process, everybody comes in is going to get a different treatment plan for the most part. And that is because it's tailored to what's going on with you, with what we found in your examination and your x-rays. And that treatment process is going to include chiropractic adjustments to address the musculoskeletal problems, the misalignments in the joints, to get the brain communicating to that joint and to that area of the body more efficiently. We can also utilize active release technique, which is a soft tissue technique that we use in our office, and we are all certified. All 4 doctors in our office are certified in this technique. And this technique uses our hands and motion through the body to remove adhesions between layers of tissue in the muscle, and also to make sure that your nerves are also moving freely throughout the joint spaces, throughout the muscles, because they weave in and out of muscle and around bones, and we want to make sure that that's working properly. And the reason we do that in our office is because we work with a lot of active people, and it shows that if we use that along with chiropractic care, patients tend to get better just a little bit faster. Now in our office, we also have the ability to use low-tech physical therapy modalities such as ultrasound, muscle stimulation, or a combination of the two. And we feel that this is one of the best ways to expedite your healing process in the early phases of your treatment plan. Along with the other therapies we talked about, we feel the combination of all of that is the best way to get you back to feeling like yourself and back to your life. Now, while low back pain is common, it is nowhere near normal. And if you are experiencing low back pain, we recommend that you get it checked out. I'm Dr. Jake Ackerson with Excel Chiropractic and Wellness. We'll see you in the next video.